Okay. Alright, my name is Jessica Littles, and today I will be performing a focused pediatric assessment on Ms. Natalie, and I also have her mother, Mrs. Barnhart, with me. Mrs. Barnhart came into the clinic saying that her daughter has been pulling at her right ear. She's been saying that right side of her face, her ear has been hurting. She's been checking her temps at home, and she's had a low-grade temp. When coming into the clinic, we checked her temp as well, and it was 100.8. So during my HPMI, some additional questions I could ask is the onset of symptoms, location, duration, how long has this been going on, also characteristics. With a pediatric patient this young, she is 4 years old, the parents will be the reporter. Also any aggravating factors, any relieving factors such as using a cool towel at night, and any treatments such as over-the-counter medication. So, Ms. Barnhart, have y'all used any over-the-counter treatments?
Just Tylenol.
Okay, just Tylenol. Anything that helps relieve the pain or fever?
Just the Tylenol.
Okay. All right. So some additional questions I could ask is if Ms. Natalie goes to daycare or possibly school. Is she in daycare or school?
She is in daycare full time.
Okay. I can also ask if any other illnesses been reported at the school that you know of?
Not that I'm aware of, no.
Okay. And then does she have any past history of drainage or ear infections?
No, she's had maybe one or two, but that was it.
Okay. And so throughout this assessment, I did provide Ms. Natalie with a teddy bear, keys, just to try to keep the pediatric patient preoccupied throughout the assessment. So the first thing I want to do with Ms. Natalie is look at her face. I'm just looking at her eyes, looking at her ears, looking to see if she has any lacerations to her face. Her ears are midline or level with the eyes. With some patients, you may have low set ears, which can be a chromosomal effect such as Down syndrome. So next I want to move over to her eyes. So with my nice little light, I want to make sure to look at her pupils, noting if she has constriction with the eye, which is the light reflex. Once the light gets on her pupil and away, she should have dilation. So Miss Nat, look, I got a cool little light, okay? Can you look at my nose? Don't I got a funny nose? That light is bright. That's bright light. Look at my nose. I got a little fairy on my nose. Look, Miss Nat.
One more time.
And I did know that she did have constriction with the light. Some issues that I could know if she did have dilation, her pupils did not constrict, possible lesion on that cranial nerve 2 or 3, possible aneurysm, and that would note further testing outside of the clinic. So next I want to move on to her ears. With her ears, I'm just looking. You want to see my cool light? You can borrow it. With her ears, I'm just noting the color, the size, looking to see if they're symmetric. Her ear color should be the same. Her auricle color should be the same color as her pigmentation. If she did have any blueness tints to her ears, or grayish or a darker tint, I would be worried about cardiac issues or any possible her not getting enough oxygenation. So I'm just looking and I'm gonna just palpate. Let me feel these little ears. I'm noting the landmarks on her ears, on both sides. I'm noting her tragus and her lobes of her ears, of her external ear. So now I'm gonna take a light and look in your ear, okay? All right. So with young patients like this, she is 4, so I'm gonna pull her ear, the top of her ear up and back. But if she was 3 and younger, I would pull it back and down. And I'm trying to get level or open that canal so I can note her ear. Ooh. Her tympanic membrane is gray, pearly gray. It's not bulging. Let's look at the right ear. Miss Natalie. All right. Okay. All right. So with the right ear, with this scenario, I would note that she has that reddish drainage to that ear. light drainage she does have. On this ear, she just had a little ceruming, which if she had too much, I would have to clean and then revisualize with that ear. So next, I want to move on to Miss Nat Nat's nose. I want to see your nose, Miss Nat Nat. All right, so I'm gonna take my light and I gotta do some looking. Ooh, I see some gold in there. So I'm noting that her septum is not deviated. She doesn't have any other particles in her ear, such as anything like kids this young can put toys in their nose, which can cause respiratory distress. She doesn't have anything of that nature in there. Her mucosa is moist, pink. She does have clear drainage, but it's not yellow or greenish. Would make me indicate that I need to do some further tests for a possible infection. All right, Miss Nat Nat. Now I'm gonna listen to your lungs, okay? You can stay just like this. Let me listen to your lungs first. All right. Can you take a deep breath for me? Real big girl breath. All right. There we go. You're doing so good. All right. All right. Her lungs are clear, equal. I don't hear a possible wheeze. Something I will also know, if she did have a wheeze, do she have any seasonal allergies? Has she been diagnosed with asthma? But her lungs are clear and equal bilaterally. And then also doing assessment, the parents can help as well. Sometimes the kids this young do get a little antsy. So you want to just keep making sure that you move smoothly throughout the assessment. Good deep breath for me. There you go. Doing good. Big girl. All right, and now I'm just listening to her heart. Let me listen to that heart. Big girl heart. I hear it. And noting her S1 and S2. And with clients this small, that PMI will be in that fourth intercostal space on that left side. Okay. And while listening to her heart sounds, a provider can also pick up if she possibly has any possible murmurs, which can also be called innocent murmurs, still murmurs. That's an additional heart sound, usually heard in between that S1 and S2. It can be like a whooshing sound. If I did hear it and she also had symptoms, I would make a referral to a pediatric cardiologist. Okay. So then, now, looking into her mouth, I want to say that to the end because kids do like that the most. So, Miss Nat Nat, look, you get to say a big ah for me. Look, Nat Nat. 1, 2, 3, ah. There we go. All right. You did good. So, while looking at her mouth, I'm noting her uvula, trying to see if it's midline, looking at her tonsils as well, trying to see if they're swollen, any possible white spots in the back, any redness, tenderness, even with palpation and lymph nodes. Some pediatric patients will say ouchie. With that, I can also further do a swab to see if she needs any other referrals or any possible antibiotics as well. So thank you, Miss Nat Nat. High five. Thank you. And thank you, Miss Barnhart. All right. That's the ceiling. That's the floor.